Next, I will go to our ranking member for her 5-minute question.
Mr. Barab, in your testimony, you stressed the critical partnership of NIOSH with OSHA and MSHA. What happens to the work of OSHA and MSHA to protect workers, including firefighters and miners, if the Trump administration continues down the path to fire large numbers of NIOSH employees?
Yeah, so NIOSH plays an extremely critical role in protecting both miners, as you mentioned, and firefighters. Let me start with firefighters are known to suffer a very high incidence and disproportionately from cancers as well as respiratory disease. And NIOSH basically assembles a register of firefighters that protects them and identifies the risks that firefighters face. They're the only agency that does this, and although some positions at NIOSH have been restored, the firefighter registry has not been restored yet, which leaves firefighters across the country. These are the guys that rush in to homes to protect us, without the kind of knowledge and protections they need to prevent them from getting cancer and heart disease. The mine issue is much more critical. Miners are suffering a much higher rate of black lung disease because of their exposure to silica in the mines these days, a disease called progressive massive fibrosis, which hits miners at a much younger age. Miners in their 30s and 40s are unable to climb the stairs. They end up dying many decades earlier than they would have. It's a tragedy and a preventable tragedy, and NIOSH provides the kind of, they provide surveillance, health care to miners. They require miners to be transferred to less dusty positions. They are critical for the safety of miners. Now, some of those positions have been restored as well, but none of the mine functions that deal with safety in mines, with the machinery in mines, other things like developing technology that will measure silica exposure on a daily basis instead of having to send the samples out and waiting weeks till you find out if you were overexposed 2 weeks ago. All of those functions are gone.
Yeah. And I know that yesterday the Secretary Kennedy announced a reinstatement of around 1/3 of the NIOSH staff who were targeted for reduction in force. What are some of the NIOSH workers that will be left unstaffed if the NIOSH employees are now reinstated immediately? Yeah,
well, I mentioned the firefighter staff and a lot of the mine safety staff, but also NIOSH does health hazard evaluations, for example. They go in and they investigate when you find a lot of workers getting sick in a workplace for no discernible reason. NIOSH will go in there and try to figure out what's happening. NIOSH plays a role in preventing the transmission of avian influenza in workplaces. Fishermen and agricultural workers have some of the highest death rates and injury rates in the American economy. NIOSH works on technical issues and researching ways to make jobs safer for those workers. There's just an enormous number of things that NIOSH does that nobody really knows about, except for the workers whose lives are extended and injuries are prevented from the work of NIOSH.
Thank you. I ask unanimous consent to enter into the record a letter from the National Safety Council on the importance for business leaders of the work of OSHA and NIOSH.
Without objection.
As I mentioned in my opening statement that there is a NIOSH-funded education and research center in my district that will be impacted by these cuts. This center and others like it are in universities around the country, fulfill NIOSH's responsibility under the Occupational Safety and Health Act, not only to facilitate important research, but also to ensure a steady supply of experts. Mr. Barab, how important it is to have field of experts trained specifically in occupational safety and health?
It's crucial. I mean, these are the people that run our health and safety system, and not just at OSHA or not just at NIOSH, throughout industry as well. These are people that receive their education largely through NIOSH education and research centers, resource centers. You can look at doctors, occupational physicians. NIOSH runs these ERCs, run the residence programs for the ERCs to train occupational physicians. I went to a conference, actually an ERC conference a couple of weeks ago in New York, and I asked, this was probably a couple of hundred people there, I asked how many of and these were people from, they were from businesses, from unions, from universities, from health groups. I asked how many of them, either in whole or in part, whose careers depended on the work that the ERCs did. Every single person in the room raised their hand. If we lose this pipeline, if we lose these people, we will have a major shortage of health and safety professionals in this country, and that can do nothing but not only endanger workers, but also raise the price of, for companies who are trying to hire health and safety professionals who have to deal with these shortages.
Yeah. Thank you. I yield back.